Family Matters.
On Afternoons with Helen Farmer.
Back to school vibes. I got back from a holiday and wrote a to-do list that makes me feel quite nauseous, to be honest, for any of the parents out there. Family responsibilities, making dentist appointments, getting haircuts, buying uniforms. It's a conversation for another day, but let's just say I'm bracing my credit card for that one. But let's talk health, that checklist to get everybody ready before term starts. Joining us live in the studio is Dr. Gordon Bland, specialist in family medicine at Clem&So Medical Centre here in Dubai. Dr. Gordon, how are you? What's keeping you busy in clinic this summer?
I'm doing really well. Lots is keeping me busy. There's funny tummy bugs around, but lots of things. People doing health checks is interesting.
I think a little bit of preventative.
Yeah.
So I'm going to totally take advantage of the fact that you're in the studio.
Go for it.
One thing I noticed a lot over the summer with my kids is an increase in picky eating. And I don't know if it's the way that a child might try to assert a bit of control and power over unfamiliar situation and go, do you know what? We're going here, we're going there. I'm only going to eat pizza for 3 weeks. But I've come back and I have just been a little bit, because we had, she was constipated when we were away. I feel like the food she's eating has just become really, really limited. When is it time to go to a doctor or go and see a paediatric nutritionist? Because, I'm throwing a few vitamin gummies down her neck, but I don't really feel like it's touching the sides.
Yeah, this can be really tricky, and it's very common in summer when we sort of drop a lot of the usual protocols and routines that we have.
Things get a bit loose.
Rules, exactly. And eating is one of those things. We relax. Okay, yeah, we'll have a little bit sort of more fast food maybe, or we'll eat out a bit more perhaps. Dinner time might not be as rigid as it used to be before.
Tick, tick, tick.
Yeah, and sleep. That'll be different as well. And physical activity and often fluid intake as well will be different for them. So getting them back on track in terms of just slowly re-encouraging, I guess, with anything with children when they're acting up, it's to try not to make a big deal of it.
I know.
The minute they work it, they've got you. They've got you.
I'm trying. My husband's going, things are going to be different when we get back to Dubai, girls. Having all the veggies when we get back to... I'm like, oh, great. This is getting some really nice emotional baggage with food. So what we did before is we try and have a similar kind of menu for the girls during the week. So I think I've been trying to think it's going to be easier when they get back to school, because at the minute routine is still completely,
and it's very hard
out of the window.
And it's hard to put in place a part of a routine, but that's going to change in a little while anyway when they do get back to school. So, focusing on what's going to be our new routine when we get there is probably the better way to do it. Okay, absolutely.
So I've got another couple of weeks to get my act together. What are some of the things we should have on our checklist when it comes to making sure our kids are going back to school healthy and happy? I mean, I'm thinking lunch boxes where we've kind of ticked that off. But, when it comes to seeing a doctor for testing, is that necessary or just a chat?
If you're at all concerned about anything regarding your children or even for your own health, absolutely come in and have a chat to your doctor. But there wouldn't be a necessity to come in routinely prior to going back to school. No. It can, though, be a good time to actually pause and take a review and assessment of the whole situation, the whole family's health, actually. So to look at, if this is preschool coming up, we usually have vaccines around this sort of time. Have we had those? Because those...
Where's the vaccination book?
Exactly. That's where did we put it? That's exactly right. And there is a big gap for kids. We often go from around the age of 12 months or 18 months, depending on which schedule you follow, and there's a big pause until about 4 to 6 years. So it's easy to lose track of that in the busyness of modern life. So taking that pause if you've got kids going back into early primary or preschool, and say, hang on, are we up to date with things? And pulling out the book and having a little look.
Now, one thing I wanted to ask you is flu over the last couple of years has been really interesting to observe. Because
Absolutely.
2020, I think there were probably about 5 cases of flu in Dubai. And it went up considerably 2021. So flu season, is probably going to be in a matter of months. But I wanted to ask about timing of vaccination. Do you tend to have a month or a season as such that you think, all right, guys, time to get booked in? Because there have been shortages in the past and
Absolutely.
need to be tuned into that.
Yeah. If you can get it done, go for it. That would be my advice. It's not the sort of vaccine that will give you maximum protection for a few weeks and then start to fade. It boosts up and keeps you primed for the whole season. So if you can get your hands on it now, go for it. That would be really good. It does change, or it can change every year, so that we recombine the flu vaccines each year in a prediction for what might be the problem strains. So yes, even if you had your flu vaccine last year, it's worth topping yourself up. And you're right, we saw very little flu during the COVID months, or COVID years, sorry. Masks obviously work, and social distancing work for those sort of things. But we're now starting to drop those, or at least we're starting to be more interactive. We still got the masks there, but we're getting back to being close contact. So, yes, we are expecting a bit of an influx on flu this year.
Be prepared. Dr. Gordon Bland is with us this afternoon, Clemenceau. Leanne's been in touch saying, hi both. Should vitamin D be a constant supplement for our kids, even if they're in the sun? Until what age should they take a supplement?
Gosh, it's a really tricky question to give a good answer. Certainly for babies and for young children, yes, we do recommend drops for vitamin D. Once they get to sort of school age or sort of later school age, it can really vary. Our skin is our producer for vitamin D, and it produces vitamin D when we're in the sun. Interestingly, the pigmentation of our skin alters how effective that is at producing vitamin D. So if you have a very dark complexion, your skin may produce less vitamin D with the same exposure for someone who doesn't have that dark complexion skin, which is one of the reasons we think we see a lot of vitamin D deficiency in Dubai. We're not slack on sunshine here. We tend not to go out in it, but we do keep covered up, and there's a lot of people who have a darker skin tone, and that can cause issues with getting good vitamin D.
Is it ever worth having kids tested for the vitamin D levels?
Certainly if they're sort of quite tired, run down, have muscle and joint aches for no particular reason, yes, it would be well worthwhile having a look at that. As a routine, perhaps not, but if you did have symptoms or concerns, yes. Can
we talk immune system? Because my youngest in particular, she was that kid that always had a snotty nose.
Gosh, yes.
And an awful lot of people are travelling right now, coming back into Dubai from all over the world with maybe COVID, but probably, just germs and all sorts of different viruses that perhaps we're not used to having. What can we be doing in the coming weeks to boost our kids' immune system so they're going in as healthy as possible and as strong as possible?
Absolutely. Look, we'd love to have a simple tablet that did exactly that boosted defences.
Come on, get working on it, Doctor.
Unfortunately, anything that tells you that's what it does is not 100% legit, unfortunately. The best we can do is keep ourselves in good health, get plenty of good sleep, get plenty of good food, and the simple things that we've always said through all of the COVID time: wash your hands. If you're sniffling and you're snotty, then try not to be blowing your nose into your hands and wiping it everywhere. So those other simple things are the most important. But the statistics are really interesting. We know that for young children, on average, kids get sick with head cold type symptoms roughly every 6 to 8 weeks.
Really?
That's an average. So some kids are going to be much more frequent and other kids never seem to get sick.
Yeah, I think mine went to nursery for about 3 days back in 2018. I was like, this is costing a fortune. This is costing
Quite
me
unfair.
Get back in there. So number one takeaway then for getting our kids ready for back to school, Dr. Gordon Bland, what would you say should be on our to-do list?
Absolutely. Get their sleep sorted. So good sleep, good food. If they're really fussy with their eating, consider vitamin supplements. I don't think you need vitamin supplements routinely, but if you're worried about the quality of food, that would be worthwhile.
And one last question saying, are saliva tests still possible for children for COVID?
Oh, that's a very good question.
I
think they are, yeah.
But what I would say is they do require a surprising amount of spit. My daughter thought this would be the easy option. She was there for about 10 minutes, bless her.
Yeah. You've really got to get a good viral pickup, and saliva can be quite diluted. So, yeah, there's nothing quite like the swab, but yes, we can do it. Saliva, yes, we have to.
Hope that helps. Dr. Gordon Bland, thank you for your time. Really
Pleasure.
do appreciate it. As said, you can be found at Clemenceau Medical Centre in the Al Judaf region, specialist in family medicine and a great team down there. So thank you for your expertise. Wishing you a healthy and happy season ahead. I was going to say, I hope to see you soon. I hope to see you soon in my office here.
Indeed, not the other way around. Indeed.
We've just been talking about sleep, and our next guest can help you with that. Julie Mallon is joining us, sleep consultant, talking about boosting immune system and sleep, but whether it is newborns, toddlers, or maybe even you, this is your chance to get the advice that you need. First, though, finding out what's happening on your roads with Milani.
Dubai Eye 103.